The development of the pandemic by corpses in the United States is linked to economic and cultural problems that the country has experienced, as the fall of the stock market in 1929 in the Great Recession or the financial crash of 2008. But this crisis was exacerbated and deepened by the pharmaceutical industry, and if there is a surname that had an influence in this sector, was Zackler through Purdue Pharma. The Zackler family is a clear example of how entrepreneurial power, marketing, and the pharmaceutical industry intertwines with serious public health consequences. In the United States over the years, faced accusations of minimizing the risks of addiction to bribe and deceive health authorities. As the Food Rock Administration, this has been portrayed in the book The Empire of Pain by Patrick Radden Keefe, who makes an X-ray of the origin, rise of this dynasty, which in turn was brought to the television series Painkiller in 2020. An agreement with the Department of Justice for Pharma paid $8.3 billion in fines, indemnities, and civil liability. However, last year, the Supreme Court of the United States annulled the Port of Pharma bankruptcy agreement because he armored the Sacred Family agree with the National Center for Health Statistics of the United States in 2022. 76,226 people died as a result of this continent. Fentanyl, this figure represents 70% of 100% of all overdose deaths of some drug. In 2023, 74,702 deaths were recorded, and the use of this drug has been focused on the West Coast in states such as Pennsylvania, where in its capital, Philadelphia, is Kensington, a neighborhood considered as the ground zero of fentanyl. In the United States, according to the American Addiction Center, for 2021, the states most affected by fentanyl were West Virginia and Tennessee, with 90.9 and 56.6 deaths per 100,000 inhabitants. These numbers lead us to the question, what has been done to address this phenomenon? The first measure to counteract this crisis, under the administration of Barack Obama, was given until 2011, 11 years after the first symptoms of the crisis, with the implementation of the PDMP, the Prescription Medication Follow-up Program. But this was not enough, according to the Centers for Control and Disease Prevention. In 2015, the corpses killed an estimated 33 by 1,000 people in the United States, almost half of them as a result of illegal prescription, i.e. sold in a pharmacy. The following year, in 2016, President Obama enacted the Comprehensive Addiction and Recovery Law, the first legislation that sought to attack the Catalan crisis in 40 years. This legislation contemplated $1 billion to address the Catalan crisis, earmarked most of the resources for the most affected entities and investment for the development of treatments to treat addicted patients. This was not enough either. In 2017, Donald Trump enacted a new federal plan to combat the national public health crisis generated by corpses in the United States. The growth of addictions to this type of analgesics worsened during the pandemic by COVID-19, according to the same National Center for Health Statistics. Between 2000 and years after the health emergency, the number of overdose deaths in the United States related to any substantially increased, passing around from 48,000 deaths per year in 2019 to 81,806 in 2022, according to the same center. In 2020, the coronavirus killed 385,000 people, while 70,000 Americans died from overdose, of which 800 due to fentanyl consumption, or one of its heroes since then. The crisis numbers are increasingly worrying. In 2020, 2.5 million Americans over the age of 18 suffered from any disorder caused by. For diamond abuse, however, only 1 in 5 people received medicine to treat it. According to data from the National Center, in 2021, through the Bicentennial Understanding, Mexico and the United States joined to reaffirm the importance of collaborating as partners and develop a shared vision of the fight against fentanyl trafficking, where the Mexican government proclaimed the U.S. a new vision to address this phenomenon. Paying attention in the causes, in 2023, President Joe Biden presented a plan to address this crisis. Directly, however, many of its action angles included measures occurring in Asian countries,